Okay, we'll start with the first case. I'm dictating you the case, you write it, and let's explain. Oh, first let me explain you some basic things, okay? Give you an idea how to diagnose a case of acidosis or alkalosis. So the normal pH of our body is 7.35 to 7.45, and this pH is extremely important for our body to maintain. What? Very important. If our pH drops less than this, acidosis will occur, and this is a life-threatening condition. Acidosis, very dangerous. We have to correct it. And if alkalosis occurs, then also we have to correct it, because it is a life-threatening condition. Because ultimately the pH of our body, this neutral pH of our body, has to be maintained anyhow. Okay. So how can we diagnose if the person is having acidosis or alkalosis? We have to diagnose it, right? So how can we diagnose? So that we can diagnose it early and give the correction, so that we can save a patient's life. So it is very important for us as doctors to diagnose these cases at earliest. For that you have to know the basics. Now how this pH is being maintained in our body? How this pH is being maintained in our body? Okay. Why do you think the pH will get lower or higher? Why do you think? Why do you think our body will go acidic or our body will go alkalic? Basic. Anything acidic component in our body must be increased. No? In that case acidosis might occur. Or the acidic component in our body might get decreased. In that way what can occur? Alkalosis can occur. Or anything basic component in our body might get increased. So what might occur? Any basic component of our body if gets increased, then what might occur? Alkalosis. And if any basic component in our body get decreased, acidosis can occur. In all these four scenarios, acidosis and alkalosis might occur. Now what are the two things which determine the pH of our body? In a given ABG, I'll show you real time ABG, okay? I'll show you real time ABG. I'll show you how a ABG looks. In a given ABG or in our body, ABG you know na, arterial blood gas. Yes. So what are the things that actually determine the pH of our body? Yes, bicarbonate, sodium bicarbonate and PaCO2. PaCO2, okay, plasma carbon dioxide and the bicarb. These are the two things which are very important for our normal pH balance of our body. Okay. Now PaCO2 is what you know? PaCO2, carbon dioxide. Carbon dioxide is acidic in nature. Okay, carbon dioxide, the gas, is acidic in nature. And bicarb is basic in nature. So if carbon dioxide gets increased in our body, what it will land up into? Acidosis. Please pay attention. If carbon dioxide in our body gets increased somehow, what will it result into? Carbon dioxide is acidic in nature. If carbon dioxide gets increased in our body, what will it get resulted into? Acidosis, right? If carbon dioxide, which is acidic in nature, gets lowered in our body, what will it result into? Alkalosis. If bicarb, which is basic in nature, gets increased in our body, what will it result into? Alkalosis. If bicarb, which is basic in nature, gets decreased in our body, what it will result into? Acidosis. Clear all of you? Now you have known everything, you know everything about the ABG, you can see and diagnose the case right now, okay. So I will tell you the cases. Why I am explaining you these things? Because you don't have to, so that you don't have to mug up. You don't have to learn these cases by heart. Like, you know, if you understand how interesting the ABG actually works in our body, how interestingly the lungs and the kidneys actually function to maintain the pH balance of our body, and you know how to diagnose, you know the formula, you know the catch, that you can see a ABG and diagnose, how powerful is that? You don't have to mug up the cases. Any case, any ABG you get in your papers, you can easily diagnose and say what it is. It is metabolic acidosis or respiratory alkalosis or whatever. It will be very easy for you guys to diagnose. No, that's why I am telling you the formula. I am not just telling you, dictating you the cases and making you write and making you learn. I am telling you this basic thing so that you can diagnose it on your own and don't only have to mug up in your papers. Alright? Okay, you will know at the end of this class, you will be confident and will be able to solve any ABG that comes your way. Okay, you just follow what I say. Okay, so this much you have understood how does alkalosis and acidosis happens. All right. Now what do you think? Carbon dioxide is maintained by which organs in our body? Gaseous exchange? Lungs. Gaseous exchange is maintained by lungs in our body. And bicarb, which is a metabolic component, is maintained by our kidneys. Okay, bicarb is a metabolic component, is maintained by our kidneys. Now for any reason, suppose carbon dioxide normal value is 40 to 45 PaCO2. Okay, 40 to 45 mmHg. Okay, in any scenario, suppose carbon dioxide is increased by that, what will it result into? Acidic components is increased, what will it result into? Acidosis. It will result into acidosis, more carbon dioxide, and it will result into more acidosis. Then you know that means what? That means the lungs are not functioning. We can't say the lung cannot functioning well. We can say that gaseous exchange is not happening properly, might be. Okay, and this is because it is a respiratory component, so we will call it what? Respiratory acidosis, because carbon dioxide is a respiratory component. It is balanced maintained by the lungs, so we will call it what? Respiratory acidosis. If the acidosis is because of increase of carbon dioxide, we will call it respiratory acidosis. Clear or not?
Yes.
If the acidosis, the pH of the blood is increased due to increase of the acidic component PaCO2, which is maintained by our lungs, we will call it respiratory acidosis. And if the PaCO2 is lowered, which is the acidic component is lowered, which is again maintained by the lungs, then it will result into alkalosis. We will call it respiratory alkalosis. Simple. Okay. Now what happens if PaCO2 is increased in our blood? Now the kidneys will tell what? Ultimately, you know, our body will try to compensate it anyhow, because I told you what? Alkalosis and acidosis is pathological, it is not normal. So our body will first try to compensate this thing on its own. Okay, kidneys will immediately do what? Kidneys will say, okay, lungs, you cannot do your work properly. PaCO2 is getting accumulated in our body. The pH is rising, which is an alarming situation. I will do what? I will increase the bicarb level. I will increase the basic level so that the pH is maintained. So that's how kidneys will come and compensate this thing. All right. Same, suppose the metabolic functions are being hampered. The bicarb balance has been increased in our body. The bicarb has been increased in our body, again resulted into alkalosis. Okay. Now lungs will say, okay, this alkalosis is happening. Something wrong is happening in our metabolic system. Metabolic functions are not happening properly. Kidneys are not doing their functions well. Lungs will come into the scene and do what? Lungs will say, okay, kidneys, you don't worry, I will increase the PaCO2. I will stop the gaseous exchange, I will increase the PaCO2 so that the pH is maintained. And that's how they work together, our body work together to compensate the acidosis and the alkalosis that happens in our body by these compensatory mechanisms. Okay, you see a perfect pH, but PaCO2 is high, bicarb is high, all these things are low high is going on, but the pH is correct, the pH is maintained. That means the body has compensated on its own. Alright? Okay. Now what if the body does not compensate? That means some problem is there. And in those scenarios, we have to give correction. We have to correct these things, alright, to save a patient's life, because these are life-threatening conditions, alright? Okay. Now I told you about the compensatory mechanisms. I told you about how bicarb and carbon dioxide, everything is happening. Have you all understood it? Clear? All of you all? Okay. Now since you have the basic idea, now we will move to the cases and we will see if you can solve these cases or not. Okay? Alright. Please do interact. Okay? Right. A 68-year-old man, fast, okay? A 68-year-old man with a history of very severe COPD, yes, COPD, presents to the EMR, emergency room, EMR, complaining of worsening dyspnea, yes, and an increase in frequency, worsening dyspnea and an increase in frequency and purulence of his sputum production over the past 2 days. His oxygen saturation is 78% in room air, room air. His oxygen saturation is 78% in RA before he is placed on 78% on room air. Before he is placed on supplemental oxygen, a sample for ABG analysis is drawn. Okay, oxygen, supplementary O2. Oxygen, a sample for ABG analysis is drawn. Clear? Okay. Now write down the ABG findings. Write down the ABG findings. pH is, in this given case, this person having COPD and he has dyspnea and his SpO2 is falling. SpO2 is 78% in room air. He is not surely maintaining the saturation, oxygen saturation. So ABG has been performed on him and his ABG values are given as pH is 7.20, PCO2 is 68, PCO2 is 68, PO2 is 48 and bicarb is 31. I am saying things very clearly. You have any problem to understand or what? Okay. Okay. Now look at the ABG. Okay. First write down the questions. What are the questions? What is the most probable diagnosis and cause of the clinical scenario? Cause of the clinical scenario. Second question. What is the biochemical basis of the above clinical condition? Biochemical basis of the above clinical condition. Aren't you writing? Written. What is the line of management of such patients? Done. Okay. Now look at the ABG, all of you. We'll try to diagnose it from the given ABG what this person is having. Alright. Ready?
Yes.
Okay. You have the understanding. I told you everything basic which you need to know. Now we will jump into the ABG and see if you can solve it or not. Alright. Now look at the pH 7.20. Is it more or less?
Less.
Less. Okay. Look at the PCO2 68. More or less?
More.
More. Look at the bicarb 31. More or less? How come it is less? Bicarb value is 22 to 26. Normal value is 22 to 26. 31 is definitely more. More. Alright. Now look at the pH. First look at the pH. pH is 7.20. It is low. Less. Alright. Less pH is what? Directly you can say, safely you can say it is acidosis. Safe to say it. Now we have to determine what? Is it a metabolic one or it is a respiratory one? Alright. Okay. Now look at the PaCO2. PCO2. PCO2 is 68. It is more or less?
It is more.
It is more. Okay. Acidic component PO2 is more. What?
Acid.
What? Respiratory?
Respiratory.
Respiratory?
This one.
Respiratory we can say. Alright, respiratory from the PaCO2 component because it is primarily increased, which is making our blood more acidic. Alright. Okay. Now look at the bicarb. Is it more or less?
More.
Again more. The basic component has increased. So we can also say metabolic
Metabolic
alkalosis.
Alkalosis.
Metabolic alkalosis we can say. Metabolic alkalosis we can say. Alright. Now see how beautifully the kidneys have tried to compensate the acidosis. See, acidosis has happened because of PaCO2, because of rise of carbon dioxide in our body. Alright. Now the kidneys have tried to compensate it by increasing the bicarb in our body. Okay. Resulting in metabolic alkalosis, but it was not enough to compensate the respiratory one. So it has ultimately resulted in respiratory acidosis. Alright. The person is ultimately having respiratory acidosis along with also metabolic alkalosis. Okay, clear? All of you are getting me? You guys are getting me or not? You guys are not responding at all. I am putting in so much of effort. You are guys, did you understand? Did you understand? You? This girl. You, did you understand? All of you all? Okay, you guys will solve. You? Understood? Understood? Clear? Okay. Understood this case? Well and clear? Or you can solve ABGs now. Are you getting a bit confident?
Yes, ma'am.
Okay. Okay. Now moving to the questions. What is the most probable diagnosis and cause of the above clinical condition? What is the diagnosis? You guys have yourself diagnosed it.
Respiratory acidosis.
Yes.
Along with the metabolic alkalosis.
Yes, right. Now write the answer. The patient is suffering from respiratory acidosis. Patient is suffering from respiratory acidosis. The patient has low pH. The patient has high PCO2 and high bicarbonate. High PCO2 bracket you write within bracket you write respiratory acidosis, and high bicarbonate within bracket you write metabolic alkalosis, as I already said and explained. More precisely, the patient suffering from respiratory acidosis with compensatory metabolic alkalosis. Okay? You understood now? Okay. Clinical presentation of acidosis is given. I'll tell you the clinical presentation. Okay. Written the answer? Okay. Now, how will a patient of respiratory acidosis clinically present? I'll tell you the points you write. Now, these things you need to learn. Okay. Clinical features and causes and etiology and everything. All these things are for you to mug up. But the things which you need to understand, I am explaining. Okay. Right. Fatafat the points you write. The presentation. Confusion, headache, anxiety, altered mental state, lethargy, heart failure, memory loss, seizures, tremors, pulmonary hypertension, coma and sweating. Alright. Now, what are the causes of respiratory acidosis? These were the presentations, how a person might come and present to you. What are the causes? Write the causes of respiratory acidosis. Central nervous system depression, stroke, central nervous system depression. Under that heading you write stroke, sedative drug misuse, alcohol overuse, airway obstruction. Next point, airway obstruction, obstructed airways due to foreign body, sleep apnea, aspiration, bronchospasm. The bronchus gets spasmed and there's the airway obstruction because of that, bronchospasm. Sleep apnea. Respiratory disorders, COPD, emphysema, pneumonia, pulmonary edema, fibrosis. Neuromuscular conditions, myasthenia gravis, GB syndrome, Guillain-Barré syndrome, Guillain-Barré syndrome, transverse myelitis or any chest injury such as kyphosis, scoliosis, obesity, cardiac arrest, all these things. Clear? Written? Okay, these things you can learn. No? These things are nothing to explain in these things. Etc. Cardiac arrest, obesity. Second question, what is the biochemical basis of the above clinical condition? Right. CO2 gas is acidic in nature. Due to any reason, if CO2 gets accumulated, CO2 gas is acidic in nature. Due to any reason, if CO2 gets accumulated in blood, why you can't follow? Shoot gaya. A CO2 gas is acidic in nature. Due to any reason, if CO2 gets accumulated in blood, it will cause dropping of pH, which will result in respiratory acidosis. I already said it. Same thing. Alright, understood? Okay. Moving on to the next question. What is the line of management of such patients? How will you manage a patient with acidosis time? The primary aim of management of the patients is to gradually correct the hypercapnia. The primary aim of management of patients is to gradually correct hypercapnia. Now, this patient which has already presented to you, he had dyspnea, he couldn't breathe, he had breathlessness, so you have to correct it, right? You have to give him oxygen support, you have to correct his hypercapnia, that is high CO2, right? So, hypercapnia needs to be corrected. The hypercapnia gradually corrected because rapid alkalization of the cerebrospinal fluid may lead to seizures. Okay.
Hypercapnia.
See, you understood the hypercapnia needs to be corrected because this person has high CO2, alright. That's why this person was having breathlessness, that person couldn't breathe. You remember the case? That person presented with the EMR with dyspnea, with breathlessness. Dyspnea is what? Breathlessness, right? You presented with breathlessness. He had accumulated a high amount of CO2 in his body, which resulted in respiratory acidosis. Alright. So, you have to do what? How will you correct it? First, you have to give him support. First, you have to so that he can breathe. Alright, you have to correct the hypercapnia. Hypercapnia is more accumulation of CO2 in our blood. We call this condition as hypercapnia. You have to correct the hypercapnia of his blood, first of all. Alright, okay. Now, gradually you have to correct the hypercapnia, or else what will happen? If you correct rapidly, our CSF will get rapidly alkalized and it might result into seizures. Okay, clear? Okay, may result into seizures. Patients who are lethargic or confused More CO2 in our body might result into drowsy patients. Patient might become drowsy or lethargic or confusion, altered mental sensorium, because CO2 will do what? Make the patient drowsy. Okay, if the person is lethargic or drowsy, needs to be monitored in ICU. Such patients needs to be monitored in ICU because they might stop breathing. Then if the brain doesn't work, those exhibit hypoventilation if they don't breathe only on their own. If they stop ventilating on their own, hypoventilation, will need endotracheal intubation and mechanical ventilation. Okay, if a person cannot breathe, we have to intubate the person, right? You know what is intubation? Yes, if a person cannot breathe, then we have to put an NT tube and you have to put the person in ventilator so that he can breathe in cases of hypoventilation. All right, endotracheal intubation, and we have to put the person in mechanical ventilation. I am repeating it 3 or 4 times. Why can't you pay attention? How many times I have to repeat? What? You copy from your friends. If I have to repeat one line for thrice or 4 times, then how will you be able to complete rest of the cases? Everyone is following right from them. Pharmacological therapy, what we can do? Pharmacological therapy can also be used to help improve the ventilation. We can give bronchodilators, right? Bronchodilators help in improving the ventilation. All right? Bronchodilators like beta agonists, anticholinergic drugs, methylxanthines can be used in treating patients with obstructive airway diseases. Okay? Beta antagonist, beta agonist, anticholinergics and methylxanthines. These are bronchodilators. They expand our airway, dilate our airway so that there is ventilation, improvement in ventilation. Okay? Naloxone can be used in patients who overdose on opioid use. This is antidote of opioid, naloxone. We can use in these patients who have overdose of opioid use. Clear? Done? Naloxone, Naloxone. Okay. Do you understood the first case? All of you all? Okay. Can we move to the second case? A 52-year-old man comes to the emergency department. Write in short form. A 52-year-old man comes to the EMR. Emergency department, write EMR. Emergency room. Complaining of shortness of breath and tingling in fingers. He is retired and living alone. How does this matter? He is retired and is living alone. His breathing is shallow and rapid. There is no history of diabetes, hypertension. Diabetes, write DM. T2 DM, type 2 diabetes mellitus. Diabetes or hypertension, write HTN, short form. You need to know these short forms. It will be easier for you guys to understand and write. Diabetes and hypertension and any other systemic illness. History reveals he had several anti-anxiety medications and also had anxiety attacks before while being worked up for chest pain, and ABG is done. So this person was on anti-anxiety medications. He do not have any systemic illness, and this person is running out of breath and he has shallow and rapid breathing. He is hyperventilating, that means, all right, he has rapid breathing, and one ABG was done. Okay. What does this ABG show? pH 7.48, PaCO2 28, bicarb 22, PaO2 85. Okay. Now pH is 7.48. Is it more or less? More. pH more, what can we say? Alkalosis. Very good. PaCO2 is more or less? Less. Bicarb is more or less? Normal. Okay, bicarb is normal, PaCO2 is less. What alkalosis can we call it?
Metabolic.
Why metabolic? Why did you think it is metabolic? Didn't you understand? Huh? Metabolic has no role to play over here. Bicarbonate is normal. It is because of the respiratory component, the PaCO2. The PaCO2, acidic PaCO2 respiratory component has gone down. That's why alkalosis is happening. Respiratory alkalosis it is. Who all said metabolic? You also said. Why? No, HCO3 is normal. Now clear? No? Clear? Okay. Alkalosis, right. Okay. Now what is the first question? What is the most probable diagnosis and cause of the above clinical condition? Write the answer. Patient is suffering from respiratory alkalosis. Respiratory alkalosis is a clinical condition that is secondary to hyperventilation. Clinical presentation of respiratory alkalosis is summarized below. I am telling you what are the presentations. Okay? Clear? Clinical presentations are paresthesia, arrhythmia, hypokalemia, sarcomural numbness, hypophosphatemia, dyspnea, confusion, seizures, tetany, muscle cramps, all of these things. Alright? Okay. Now what are the causes of respiratory alkalosis? Anxiety, sepsis, central nervous system stimulation, sepsis, anxiety, aspirin overdose, pregnancy, cirrhosis, hypoxemia, hyperthyroidism. Next question. What are the other clinical diagnoses? Differential diagnosis. Okay. What are the other clinical diagnoses for this clinical presentation? If a same clinical presentation comes to you, what are the other diagnoses that you can make out except for alkalosis in these patients? That means what? That means they are asking you for the differential diagnosis of alkalosis. Understood? Okay. Write the differential diagnosis. Asthma, aspiration. Asthma, you write. Asthma. AF is atrial fibrillation and atrial flutter. Asthma, AF, atrial fibrillation and flutter, tachycardia, pneumonia, meningitis, myocardial infarction, panic disorder, pneumothorax, sepsis, COPD, head trauma, pulmonary edema, hyperthyroidism, all of these cases. Okay, these are the differential diagnosis. Now moving to the third question. What is the line of management of such patients? Line of management, how will you treat these patients? Okay, respiratory alkalosis itself is not a life threatening and management is based on underlying etiology. You know what are the causes that is causing alkalosis? We will treat that and the alkalosis will automatically subside. Okay, we will treat the underlying causes, and before treating the underlying causes, side by side we will give what? Palliative treatment. Like if the person is apnea, if the person is having if the person is having apnea or something like that, we will give him oxygen support or anything like that. Okay, supportive treatment, mainly palliative or supportive treatment. Treatment are what? Treatment are either supportive, palliative or symptomatic or etiological treatment. Etiological treatment is what? We treat the cause, and supportive and palliative treatment is what? We treat the symptoms, we treat the signs and symptoms. Like PCM, paracetamol we have when we have fever, but we also have antibiotics to treat the cause of the fever. Alright, so antibiotics are what? Etiological treatment, and PCM is what? Paracetamol is what? Supportive treatments. Like that, in all these cases also we have to give supportive treatment and treat the underlying etiology so that the alkalosis gets corrected. Alright, administering an opioid, pain reliever or anti-anxiety medications to relieve hyperventilation. Administering an opioid, pain reliever or anti-anxiety medication to reduce hyperventilation. Providing oxygen to help keep a person from hyperventilating. The person had what? Rapid and shallow breathing. The person was having rapid and shallow breathing in this case. No, that means he was hyperventilating. If a person will continue to hyperventilate for long period of time, if a person is ventilating more and more like this. Hyperventilating means what? Like this, like that. So his respiratory muscles will get fatigued very soon. No? What are our respiratory muscles? What is the muscle that helps in respiration? Diaphragm. You know, so our diaphragm will get fatigued very easily, and in that case, if the diaphragm stops functioning, if the diaphragm gets fatigued, if the diaphragm gets tired, then the patient will end up in what? Respiratory failure. He won't be able to breathe at all. So that's why we have to give him supportive oxygen. In cases of hyperventilation, the patient, if the patient is hyperventilating, means what? Respiratory rate is increased. You see, no, you count the respiratory rates in physiology by looking at the chest movements. No, like that you look at the chest movement, and if the chest is rising, you like that you count the respiratory rate. What is the normal respiratory rate? 16 to 20, right? 16 to 20, right? Yes. So if the person is hyperventilating, if his respiratory rate is 40, means what? His diaphragm will get fatigued very soon. So in those cases, we have to give him supportive oxygen so that his muscles do not get fatigued and he gets the oxygen support from outside. Alright. So in cases of hyperventilation, we have to administer oxygen. Okay. Correcting any heart rhythm abnormalities by using medications or any other medications which is needed for correcting the underlying cause. Okay. Are you writing or just listening? You have to write these answers. Written? Okay. Done. Now we will move to the next case. Okay. Right. Mr. Ramesh, 45-year-old male, was brought to the EMR with complaints of increasing fatigue, nausea and vomiting for the past 2 days. He began experiencing abdominal pain and shortness of breath.
For past 2 days.
Yes, he began experiencing abdominal pain in abdomen and shortness of breath for past 24 hours. Okay. His family reports to poor appetite and confusion. His family reports poor appetite and confusion. He has not taken his insulin for the past 2 weeks due to loss of appetite and financial issues. 2 weeks due to loss of appetite. Okay. His ABG is as follows. His ABG is pH is 7.12, PCO2 is 22. pH is 7.12 means what? pH is lowered. Safely we can say acidosis. PCO2 is 22 means what? PCO2 is lowered. It is lowered. Okay. And bicarb is also lowered. Both of the things are lowered. PCO2 is lowered. Means what? Acidic component, acidic respiratory component is lowered. Means what? Respiratory acidosis. And bicarb 10 is also lowered. Means basic component has also lowered. Because of this also acidosis has occurred. Means what? Metabolic acidosis is also there. Ultimately both of these things has resulted into acidosis only. Okay, but both are present over here. Respiratory and metabolic. Both. Respiratory acidosis and metabolic acidosis. Nothing is compensated. Nothing is working. Respiratory and metabolic acidosis is present in this case. But I think for your level, if you can detect both the cases is present, that is very well and good. Or if you can't, just say what is more prominent. What is more prominent? What is more lowered over here? What is more lowered over here? Bicarb. Bicarb is more affected. So we can say metabolic acidosis. But both the terms are correct. If you say metabolic acidosis, respiratory acidosis, no one can state you wrong. Okay? Both are correct. But if you want, you can also say the prominent one. Alright? Okay. So what is the diagnosis?
Respiratory and metabolic acidosis.
Okay. Or metabolic acidosis also you can say. Or both. First say metabolic acidosis because it is prominent. And then say respiratory acidosis which is also present. Okay. But I don't think at your level both the scenarios will be asked in a single case. You will be given with simple cases in which if you can only detect metabolic or respiratory acidosis or alkalosis, I think that's more than enough for your level. I think, okay, no, I don't think they will give you complicated cases as such. Okay. Okay. Now, what is the management plan? IV fluid resuscitation, right? RX, IV fluid resuscitation. To correct the dehydration, we will give him lots of IV fluid. Okay. Then insulin therapy, because he has not taken insulin, we will give him insulin therapy. All right. Then electrolyte correction, we will give him electrolyte correction. All right. We can, by looking at the ABG, we can also see if there is electrolyte imbalance or not. Do you want to see real life ABG? Do you want to see?
Yes, ma'am.
Okay, I'll show you how a real life ABG reel looks like. Okay. From that ABG, you can get a direct idea of everything actually, what is going on. Most of the things what is going on inside your body, you can see by looking at the ABG. You can see acidosis, alkalosis, so you can detect only. Besides that, you can see hemoglobin, you can see chloride, sodium, carbon, this one, potassium, calcium. So many things you can detect. And if there is any electrolyte disbalance, you can also correct them by looking at the ABGs also. All right. Okay. Okay, I'll show you how it looks like. So, if electrolyte correction is needed, we will give that also, and frequent monitoring of ABG every 2 to 4 hours. Every 2 to 4 hours, we will monitor the patient. And when we will do bicarbonate therapy? Bicarbonate therapy, when we will give bicarbonate to the patient? If the pH is less than 6.9. Okay. If pH gets less than 6.9, then we will start with bicarb therapy. We will give bicarb to the patient. Okay, soda bicarb. Okay, and besides that, we will give the patient supportive care like cardiac monitoring, input-output charting, and all of these things. Monitor severe signs of cerebral edema or not. All of these things we will do in supportive care. All right, written? Okay. Understood this case? So, are you having an idea how to detect, diagnose cases like that? Can you solve ABGs when given to you in your questions, in your exams? Are you confident? Okay. Okay, next case. A patient, Mrs. Shalini, 60-year-old female, has presented to the OPD with progressive muscle cramps, fatigue, and episodes of dizziness for over 3 days. Muscle cramp, fatigue, and episodes of dizziness for over 3 days. She also noted mild shortness of breath and heart palpitations. There was no chest pain or syncope. She had been self-medicating.
No chest pain or
Syncope, SYNCOPE. There was no chest pain or syncope. She had been self-medicating. She has been taking medications on her own. Okay. What is her ABG? pH is 7.51, PCO2 is 47, and bicarb is 34. pH is 7.51 means what? Alkalosis. Okay. PCO2 is 47 means what? Tell me, is it normal, more or increased or less?
more.
47 PCO2 is? What is the normal value?
45, 40 to 45, 40 to 45,
40 to 48.
45.
40 to 48. I already told you the normal value. Didn't you all write? 40 to 48 is normal value of PCO2. And 22 to 26 is the normal value of bicarb. PCO2 is 47 means what? Normal. Bicarb is 34 means what? It has increased. So it is what?
Metabolic.
Basic component has increased, resulted in alkalosis. Basic component is regulated by what? This is the metabolic basic component means what? It is a case of metabolic alkalosis. Understood? Okay. Now how will you manage this patient? Right, management. IV fluid replacement, KCl supplementation, potassium chloride supplementation, monitor electrolytes and ABG every 6 to 8 hours, magnesium replacement if needed, monitor ABG 6 to 8 hours. Okay, done? So these are the treatment plans you can perform in these patients. Understood?
Last point. The
Magnesium replacement if needed. Understood? Okay. So we are done with our cases. Now did you all understand or not? You though said you understand, but you can't diagnose only correctly. Do you want to solve real life ABGs now for practice? Okay, right, this one only you solve. pH is 7.46, PCO2 is 28.5 and bicarb is 20. pH 7.46 is what? Slightly increased. PCO2 28.5 is lowered. Bicarb 20 is
low.
lowered. What is this case? Yes. This is first of all, this is alkalosis. Second of all, PCO2 acidic thing is lowered. Means what? Alkalosis, respiratory alkalosis. And then
Metabolic.
basic thing is also lowered, bicarb, which is
Metabolic.
metabolic acidosis. Lowered, huh? Basic component is lowered. That means what? Acidosis is present. No. That's what metabolic acidosis. Slight metabolic acidosis is here. Respiratory alkalosis is also here. And total, they have compensated on their own and they resulted in alkalosis, respiratory alkalosis. Okay. So this is a case of respiratory alkalosis. Okay. Understood? You have confusion. You didn't understand. Okay. More than this, I don't know how to explain better than this. If you have any idea, tell me. Any better idea of teaching? No, this is the best. Really? Wow, thanks. Okay, I'm thrilled by your reviews. If you didn't understand, if you have any doubt, you can tell me. Who said yeah? Huh? Show me your face. You said yeah. आदत हो गई है. One tight slap I'll give. Okay, next case. Do you want to solve? Is it interesting or not? I find ABG is very interesting. Because ABGs are so powerful, you can already say what a patient is going through by looking at the ABG. Isn't it interesting?
Yes,
Don't you find it interesting? These girls aren't interacting at all. You are understanding now? Yeah, sure. Sure, you? Why are you so shy? Okay. Next case, right? pH 7.44. PCO2 34.7. Bicarb 23.7. What is wrong with this person? Let me also diagnose with you. 34.7. 7.44 pH is normal. Who said alkalosis acidosis? pH is normal, nothing is there. Already it is compensated. है? नहीं होगा, वो कॉम्पेंसेट हो गया. तुमको करेक्ट करने की जरूरत नहीं है. लंग्स और किडनी से आपस में बात करके कॉम्पेंसेट कर लिया है. नथिंग इज प्रेजेंट ओवर हियर. द पीएच इज नॉर्मल. इसलिए मैं कहती हूँ गो स्टेप बाय स्टेप. लुक एट द पीएच फर्स्ट. पीएच के बाद आपको पता चलेगा एल्कलोसिस है एसिडोसिस है. उसके बाद आप आओ ना मेटाबॉलिक है रेस्पिरेटरी है. फर्स्ट यू सी द पीएच. You are not seeing the pH straight away. You are jumping into the PCO2 or HCO3. फिर तो आप ऐसे ही बोलोगे. Your the pH is normal. If the pH is normal, nothing is there. Neither acidosis nor alkalosis. Nothing is there. First criteria is only pH. If pH is higher or lower, तभी होगा ना acidosis या alkalosis. pH अगर balance out हो गया तो काहे का acidosis और काहे का alkalosis? Normal है फिर तो, है ना? This is normal. This is compensated. Compensated what? Compensated what? PCO2 is lowered. That means respiratory alkalosis is here. was here. Okay, and bicarb is normal. Bicarb is normal. That means it is what? It is a compensated respiratory alkalosis. Understood or not? Understood or not? This is a case of compensated respiratory alkalosis. Done? Understood? Okay. So you understood, no? By looking at the pH, you can only say, यहाँ पे pH is already maintained. No acidosis or alkalosis is there. This is a compensated respiratory alkalosis. Already it has been compensated. Understood? Okay. More you want to solve? No. He doesn't want to. He said no. You said no. तुमने ऐसे नहीं किया अभी? My God, you people are this typicals, really. Timing से बैठ गई है. बाप रे. Dangerous you people are. Okay. pH is 7.4 and this I am only telling you from my stock. This I have these cases with me. I solved all these ABGs when I used to work as an RMO in ICU. So daily we have to solve ABGs and correct the patients and give corrections to the patients, all the ICU patients. So these are real life ABGs of real life patients. Yes, these are real life cases. Only the first 4 cases are man-made. Ma'am has made for you. I have given you the cases. These are real life cases which I am showing you. These are real life cases. For your practice I am showing you so that you can understand. Okay. 7.41 is the pH. PCO2 is 41.4. Bicarb is 26.1. pH is 7.41. Compensated, metabolic. Nothing is wrong with this pH. Nothing is compensated. His ABG is fine. This is a normal ABG. कहाँ 0.5 है? 7.41 is normal pH. PCO2 41.4 is normal PO2. Bicarb 26.1. नॉर्मल ही है ये तो. चलो टेक्निकल अगर बता सकते तो 26 ही पकड़ लो तो ये नॉर्मल है. नॉर्मल है ना? बस खत्म. ठीक है.